Hi, Dr. Jake here, touching base on shoulder rehab part two. And I had a patient come in recently and put his head down, shaking his head, and said, Jake, I got the itis. I don't know what to do about it. And he was obviously talking about some type of inflammatory response because itis, at an end of a medical term, is inflammatory response. And there is different things that different medical docs do or medical professionals do to look at that and treat that. So if we're talking, let's say tendonitis, so shoulder tendonitis, supraspinatus tendonitis, bursitis, all these things, especially related to shoulders, have different various scary terms and fear factors to them. So if I went to a medical doc and I told him I had tendonitis, then more than likely you might get anti-inflammatory, maybe a muscle relaxer, and looking towards a cortisone shot. Um, if you went to, let's say, an orthopedic, they might do a cortisone shot and then look towards surgery if it's repetitive, um, and possibly get additional MRI to see if there's tears. If you're looking at a rehab specialist, then what they're going to look at is biomechanics. There's a reason that the tendonitis actually occurred. And the last thing you want to do is just put a band aid on it because, yeah, it might take away the inflammatory response, but that pain is going to keep reoccurring until something actually tears. It's telling you that something isn't moving right. Let's correct it. So, as a rehab guy myself, I look at the biomechanics, see how positioned the shoulder is, see how everything is moving, and take the problem away so that way the itis has a chance to decrease naturally, and correcting form and movement will take away the shearing. So there is no major injury going on. When we look at bursitis, bursitis is a different tale. Guess what? It's the second level or second tier of what tendonitis is. So you have five bursas within the shoulder, and the bursa is basically to make sure that the tendons move comfortably over the bony propositions. Now, when there is shearing going on, then you get tendonitis. If that continues, then bursitis, which are little packets of possible inflammatory responses within the shoulder, when that gets inflamed, it becomes very tender to the touch, which means you're not able to move it. And it's your body saying, hey, dummy, something is seriously going on. Stop moving. And so, again, the natural response, if you go to certain professions, it might be take away the inflammation as quick as possible using drugs or any other influence. However, my personal opinion, I believe correcting the biomechanics so there is no shearing or injury is the best and long term result. These are the things that I am going to talk further about in the next few series. So we determine how to position the shoulder correctly, which we did in series one or part one. How to co-contract, which co-contracting the muscles helps proximate the joints, and that way there's not a whole lot of movement within the joint itself that could cause havoc. And then furthering range of motion in all different directions. And so those three will add fluidity into your movement, and again make for a strong foundation, because the last thing we want to do is load a unstable foundation. If we continue to do so, then that's where you get the itis. Let's prevent the itis. Let's do better. If you guys have any questions, have any concerns, I'll be happy to answer them and give you some light on whatever issue you're having. But this is Dr. Jake signing off. Love you. Bye.